Hi, I'm Rohit Gandhi.
And I'm Marc Veilleux.
You may remember us from such films as The Little Toaster Goes to the Anatomy Elective.
Today, we'll be introducing you to dissection electives and giving you tips to keep everyone safe.
The first dissection in human anatomy is an inspiring and moving experience. It is a great privilege to dissect the remains of another human being. The bodies used for dissection are donated to the university from members of our community for the purpose of education of health professionals.
Clean dissection comes at the expense of time and effort. It is worth the time and effort because the knowledge gained will be put to use throughout the length of your career.
Hey everybody, I'm ready for my dissection elective.
Protective clothing must be worn at all times during your dissection period. Under no circumstances may sandals or open-toed shoes be worn in the laboratory. A lab coat. Protective goggles and gloves must be worn to prevent contact with human tissue and the chemical fixatives.
You'll use various dissection instruments during your dissection elective sessions. Forceps, the primary dissection tool after your fingers. Forceps are used to lift and hold nerves and other structures. Forceps, along with probes, are used to tear connective tissue to expose nerves and vessels without damaging them. Hemostat. This is a powerful grasping tool that is helpful in skin removal. Please note, however, that its disadvantage is that it crushes delicate structures. Scissors. Scissors can be useful in cutting and transection. Scalpel. Used as both a skinning tool and a dissection tool. Please note, scalpels are very sharp and not recommended for all dissections because they cut small structures without allowing you to feel them.
The majority of injuries that occur in the anatomy lab are the result of improper scalpel safety. Please follow the following guidelines when you handle the scalpel. Proper loading and unloading of the scalpel blade is very important. Always use an artery forceps without teeth, to load a blade onto the scalpel handle. Take your blade packaging and open it up to expose only the tail of the blade. Transfer the package over to your forceps. Next, align the blade with the scalpel handle. Note that there is an incline on the blade as well as on the scalpel handle. These inclines have to line up. Have the handle approach the blade underneath so that you can slide the blade into the groove on the head of the handle. Slide it forward until you hear it click. The blade is held within a groove at the head of the handle. To remove a used scalpel blade, insert one leg of the forceps underneath the tail of the blade. Grasp, lift up, and push out. Slide it into the sharps container.
Well, we hope you've enjoyed our dissection video. Remember that safety is very important.
Don't forget to wash your hands and enjoy your dissection.